Welcome to Resilience Redefined. I'm your host, Michael Ostrolenk. This show is about building better humans, institutions, and systems. On the show, I'll be interviewing many different experts from across many different fields, including human optimization, health and fitness, team building, mind-body medicine. In the institutional space, we're looking at different institutions and how we can create new ones, new models and maps, including in medicine, in education, in intelligence community, in law enforcement, in the military, especially in the special operations community. Thanks for being here and enjoy the show.
I'm honored to have Dr. Jerry Bailey. He does many, many different things, but today's conversation is going to be about men's health. And I'm really excited about this. I've been reading many of the articles that you're referenced in. You and I have had conversations about men's health and the challenges men face these days.
Mhm.
Before we dive into what's the problem, what are some of the solutions? Jerry, tell us a little bit about yourself and what led you down the path to doing the work you do now.
I'm an amazing guy. I try to have a little fun, as you know, Mike. Yeah. So me, myself, and I've been a chiropractor, acupuncturist, and functional medicine doc for 25 years now, since 2000, and got into my wife and I were in undergrad together doing exercise physiology and nutrition, and kind of knew I wasn't sure we wanted to do there yet. We both looked at med schools and medical programs, itself to be medical providers, and decided it wasn't the route we wanted to go. And she had discovered naturopathic medicine back in the old days when you didn't have internet. This is pre-internet, of course. And you had the old, files of careers in the career center at your university. And she's coming through and finds, in the medical stuff, she's like, MD, heck no, I don't want to do that. DO, maybe. And then she found naturopathic medicine and was like, that's what she wants to do. And then I was looking at med school itself, but also PhD programs to kind of be a lecturer teacher because I enjoyed that, research and stuff. And then chiropractic came up and I was like, oh yeah, that's more kind of the route I need to go. And, it kind of led there was I was doing my internship in cardiac rehab and got to know, had to spend time in surgery doing, the cath lab, doing open heart surgeries, not doing them, but being there with the surgeons and the staff and everything, and decided that's kind of what I wanted to do at that point. And then towards the end of my internship, I spent time with some of the cardiologists and the surgeons and said, hey, guys and gals, this is what I want to do. I want to do what you guys are doing. What's the best med school? What's the best residency? And every single one of them but one said, do something else with your life.
Wow.
The divine intervention there,
Yeah, yeah, yeah.
And it's like, okay, well, thanks for killing the dream. Uh, what do you all suggest? And every single one said prevention. At that time in 1995, prevention was in the cardiac world was Dean Ornish was a vegetarian diet,
Yeah.
which we know, is okay, but not the best personally. Through there. And so they said do prevention. And so Pamela found naturopathic. And then I was like, well, she's doing that. I'm not going to do the same thing. And chiropractic was there also and enjoyed that. I'd seen a chiropractor for some, sports injuries and things. And it was very not dissimilar to naturopathic and was like, I'm going to do that because I was more into the physical medicine aspect of it. A little more, it seemed more masculine, like we talked a bit ago, masculine, feminine type field. It's definitely a masculine field and naturopathic's more feminine. So it kind of fit the role of who I was and everything. And so we moved west at 22 and 23 years old, packed up the U-Haul with the car on back and drove from Michigan to Oregon. And was like, what the hell is our parents thinking to allow that to occur? And the rest is history. We finished school, came here in Idaho, Coeur d'Alene, Idaho, where we are now, and been here for 25 years, loving every minute of it. And for myself, being a guy, our practice has changed over the 25 years, as I think most do, who really love what they do and love their patients and care about their clients, and their practice changes as they change, as they age. And that's been with us. When we were younger, it was definitely more fertility and infertility, helping with ladies getting pregnant. Still help with that for guys and gals. And then as we've aged, it's now, since we're in that peri time period of life.
Paris, I see.
Yeah. We grow the beard, get some grays in there.
Exactly.
We're in that peri time of life, as we call it, those middle years. So dealing, working with perimenopause and postmenopausal women, and for guys, that same time period, we see the andropause, or I see the PHAT syndrome. One of the things I see that I coined, that PHAT syndrome, that comes up, and my guys, nearly every single one that walks in the clinic, and just building on from there. So that's what got me involved with men, because coincidentally, I have the same issues as all the guys have, even though I'm healthy, active, and do the right stuff. Guess what, man? The stuff we're exposed to in life causes these problems, and we see it come up, and I have the same issues. So been working on those and getting myself healthier, and my level's all perfect.
Definitely want to jump into the fat syndrome.
Yeah.
I'll got to do a shout out to you because you're an awesome chiropractor.
Thank you, sir.
I know that, seriously, I know that from firsthand experience, because remember 2 years ago,
Yeah.
giving a talk at a longevity conference. And the day before, I injured a rib. I had a rib out of place and I couldn't breathe. And giving a talk while you can't breathe really is really hard. And you
Yeah.
were at the same conference and you kept doing manipulations on me to help me put the rib back into place so I could breathe. And then like a couple of hours later, you come back and you help fix me so I could like make it through the whole day of the conference. Thank you for that.
Oh yeah, of course, of course.
That was awesome. Yeah. All right. So the fat syndrome, you named it. Talk to us about what is the fat syndrome?
Oh yeah. So PHAT, besides being fat, awesome. From the us generations back in the 90s, pretty hot and tempting. Little different meaning now for us guys. It's polyhormonal, adrenal, and testosterone deficiency, PHAT for short. So we will see kind of 8 key things come up in men around this bracket here. We see insulin resistance. So we start seeing that diabetes, prediabetes, the body becoming resistant, cell becoming resistant there pop up. We'll see increase in body fat, adipose tissue occur. We'll see the cardiovascular dysfunction that happens there also, which is cholesterol changes, because as this is one thing that rarely gets talked about, as medicine tries to make cholesterol this bad agent, and it's not, man. Cholesterol is an amazing thing. It helps feed the brain. It makes our cells really soft and supple if the correct amounts are there. And it also it's the precursor for our hormones, our reproductive hormones and our cortisol. So as I'll use it as a balance, is like, as we see hormones drop in a person's body, what happens? Cholesterol goes up. So then you go, okay, well, now we got these cholesterol issues, so let's give you a statin medication. Let's decrease that. What's going to happen to those hormones?
Further down, yeah.
They're going to drop further down. So we'll see those cardiovascular changes, lipid changes, and potential increased risk of factors there for cardiovascular injury. But we want to balance there too. We'll see decreased muscle mass, so that sarcopenia start to happen there. We'll see maladaptive stress responses also occur. So the stress response in the body becomes overly responsive from triggers throughout life. And so we'll see that high cortisol levels, adrenal, kind of the old terms of adrenal insufficiency, adrenal, those type things. We'll see that a stress response occur faulty, start to happen. We'll see the hormone imbalances, like we talked about, that testosterone start to decrease, estrogen can creep up through there. And then we'll see potentially some neurological issues develop also. So brain, memory, fatigue, those things occur. And then, of course, not only with this, as those changes happen hormonally and cardiovascularly with the cholesterols and the resistance and the body fat and the muscle mass, we start seeing the cells themselves get a little more permeable and tissues get more permeable. So we'll see changes in the prostate. So PSA starts to elevate.
Okay.
We'll see the testes get a little leaky also. So the cells, and so you'll see that also, that testosterone start to decrease too because of that.
So let's, if you don't mind, let's break each of those things down. So
yeah, there's a lot there.
Yeah. So like, is there an age range for this that you notice?
I'll see 35 to 60 is typically where we see these.
Okay. So let's just say someone in their late 30s notices less muscle mass, increased dad bod, and fat.
Yeah.
Not just fat in the midsection.
Yep. Adiposity there in the tissue there.
So they would come to you, and I mean, you obviously you can see physically, and you can see that there's some changes. But I would imagine there's blood work that gets done.
Yep.
And then there's some subjective reporting that they can share with you how they feel, which gives you some indications on what to do as well. Walk through some of the things like someone might share with you feelings they have inside their own body, which might indicate to you they're going to have.
Yeah. Yeah. Guys, usually I'm fine. My wife made me come in. I don't know why I'm here.
Yeah.
Sometimes, I mean, truly, guys, Often it's that case. It's like, I'm fine. There's nothing wrong. But they'll come in there like, I'm just not performing as well as I should be. Like the workouts when I work out are taking me longer to recover. I'm not as strong as I used to be. I'm more fatigued. My motivation is shot. My discipline is shot. Uh, Brain fog. I forgot where I left my keys most of the time. Performance in the bedroom has significantly decreased. Performance in the boardroom, the boardroom. Erectile dysfunction, sex drive. There too, we'll see all of that decrease in the guys. They may even notice they're napping more in the afternoon. They're fatigued. They get home from work or they have an afternoon break, and they're just out cold. They have dinner, they're out cold. So they'll notice that even more. They might notice some gas and bloating has increased significantly sometimes during that time period too. And they're just not feeling good.
All right. So then you take blood work. What are you looking for in the blood that if someone has PHAT syndrome?
So we're going to run we run basically the Boston Heart Lab to look full panel for cardiovascular there to look not just like those top three, your HDLs, LDLs, and triglycerides and total cholesterol, the boring stuff that just tells you very little. We run that breakdown of, how the LDL is breaking down, how your HDL is breaking down, what's your apoprotein A, apoprotein B, what's your real risk factors for cardiovascular incidence here and atherosclerosis there. We'll look at your total testosterone, free testosterone, because total is great. Total is that number of what's there, but your free is really what's available. And I'll see that with guys as they come in. They're like, well, my doc says my total is fine, 500-600. I'm like, that's a pretty good number. It's an average number of what we see. We like it a little higher, a little more 700 to 900 in the body itself. And then I'll go, okay, well, what's your free? Oh, I don't know. Okay. Well, let's run free because that tells us where it's at. And the ranges there is anywhere from 7 to like 21 for most guys. Most guys will be close to that 7 coming in. They'll have normal testosterone levels. I've even seen guys on testosterone with a 1200 level of testosterone in the blood, and their free is still like 7, 8, 9.
What? Okay. So even if they're on TRT or not, how could one have high availability but not high usage?
Liver function is a big one because that liver is where that total testosterone, that testosterone is converted to free.
Okay. So there's liver challenges.
Yeah. So the liver, and that could be from nutrient deficiency.
Okay.
Poor diet, obviously.
Yeah.
And the leaky gut, so that membrane permeability, like we talked about for the kind of 8 key things, that can all be contributing to that liver dysfunction, not disease, liver dysfunction that's not allowing the conversion of the hormones to occur.
Now, is there tests like liver enzymes that you might do that would help determine?
Yeah. Within there, we look at liver enzymes, and most of the time, those are fairly normal. They're not elevated, not because it's not a disease process; it's a function. So we'll look more at an organic acids test to go, how is that function of the liver and kidney actually doing? What detoxification pathways are blocked or not functioning through there? So we'll get at more of a functional state there itself.
Yeah, that's fascinating. And I would imagine a heavy drinker that not necessarily have cirrhosis of the liver, but that can contribute to liver dysfunction and then testosterone.
Yeah, alcohol and then food. I mean, they have the alcoholic fatty liver disease, cirrhosis that we know of, and that used to be called non-alcoholic fatty liver disease. Now it's called metabolic associated fatty liver disease. They've changed the name, spent millions of dollars to change a letter on there. Thank God. And they said it's from diet. Is you start getting fatty liver and you start seeing changes in that liver function from crappy diet, and so that's a big one that leads to this problem.
Crappy diet meaning like what?
High fat, high carbohydrate, as far as simple carbohydrate, the junk foods in there. They're not getting a good nutrient dense kind of paleo Mediterranean style, good meats, good vegetables, olive oil, low grain count within there.
Okay, good. Because I think it's important because people say, oh, you should fix your diet. What's that mean? So a little bit of clarity on that.
Yeah. And that's mostly what we work with clients is getting them on that little higher protein diet because they're not getting enough protein. good complex carbohydrates from vegetables and a little bit of fruit there. A little bit of grains are okay as long as you're not gluten or grain sensitive, but not a ton. And then really high polyphenol count, or now the term has changed from from polyphenol to biophenols in the olive oil world. So your high biophenols count olive oils are really, really good to take in. And how do you tell you got a good high biophenol olive oil? It should be peppery. So when you get it in, you'll kind of get that oily olive taste. Within a few moments, it's like pepper. It starts getting like, oh, you start get that little pepper cough. That's how you know you got a really good olive oil.
That's good. Is there a particular location of the world, like Spain, Italy, Greece? Is it not?
Regions, Spain, Italy, Greece are good regions there to go. They're usually a smaller farm that does that. One place that I know you can go online to, it's here locally where I'm at in Coeur d'Alene, but they ship all over the place. It's Migliore, migliore.com. And they ship all over the place, and they do high polyphenol, high biophenols. See, I got to get used to the terminology again. In there for the olive oils. But there's places, Austin, where you are, other places that you can find them. But if you go into an olive oil shop, they should not be in, glass containers. They should be in a metal container. And then, except for when you take that oil home, they should be in the green glass or brown glass. And you should ask them like, what's the polyphenol? Can you, or biophenol count here? If they can't tell you, or they have no idea what you're talking about, it's not going to be good oils.
Now, I imagine one of the recommendations is using it for cooking purposes.
Cooking, yes.
But also, would you put it on a salad? Would you put it on, on its own on things besides for cooking purposes?
For sure. We even tell clients do 2 tablespoons in the morning.
Okay, that's where I was going to go. I was going to ask you, people.
Yeah, because you're going to get those good omega fatty acids in there, which are going to take those cells that tend to be really rigid with inflammation, get them nice and soft and supple.
It's like little yoga.
Yeah, yoga. Yeah, wait, yoga for yoga for the body, the cells.
Oh, cool. All right, so that's one of the things you do. All right, so let's just say you have a client who's 35. He has all this like poor sex drive, erectile dysfunction, brain fog, little body, bad bod, all the stuff, less muscle. You do all the blood work, and let's just assume it's an average. He's not dying of something, like it's an average.
There's no disease process occurring at this point in time.
Yeah, that's a nice way of saying what I just said. So, what do you do next? I heard you just walk through, like, hey, some dietary changes, higher protein, better quality vegetables and fruits, more grains. How about seeds, nuts, and things like that?
Yeah, seeds and nuts tend to run fairly fine for guys. I know there's, I've been asked many times, because women will do seed cycling depending on where they are in their cycle, and just different different type of seeds while they're in their cycle. And I've been asked that multiple times at conferences, like, is there a guy version? And I was like, no, your pumpkin seeds are going to be really great for your prostate and sexual dysfunction there, sexual function there overall, spermatic production, testosterone production. But there isn't. All seeds are good. You want to be careful with flax seeds. They can be estrogenic for guys, so you want to be careful with the flax seeds itself. But sticking with like pumpkin seeds and sunflower seeds, those are pretty darn good. And that
estrogenic, some of the things I hear is like there's the testosterone numbers, generally speaking, are reducing over time.
Yeah, significantly.
They're dropping, and a lot of people are talking about that there's estrogenic effects of the environmental toxins that are now part of our everyday life. Are you finding the numbers decreasing in your own practice too? Younger.
Yeah. There was a study in 2007 that showed they were about, the testosterone levels was 50% of what they were in the 70s.
50%.
Yeah. And it's just getting worse over time. It's just getting worse over time with that. And that's increasing male infertility in there and changing how our body functions immensely. But testosterone levels are tanking like crazy. Like I say, with few exceptions, most guys I see are low testosterone when they come into the clinic.
So we do dietary changes. What else do you recommend to overcome the fat syndrome for your clients?
Yeah. I have a whole coaching program that we take clients through. We have health coaches that they work with also. And so we've laid out, specific programs that they will follow: food elimination process, and then putting foods back in, detoxification during that process also. So like you were saying, the environmental disrupting chemicals, the EDCs that are, or excuse me, endocrine disrupting chemicals that are out there from the environment. I mean, they're everywhere. We are exposed to them constantly. Plastics and the microplastics are now finding in the cells and in the body, and in research are finding these things. And so we're exposed constantly. So we need constant cleaning and support in that process. So during there, we're using specific herbal supplements and vitamin supplements that are actually receptors that have those endocrine disrupting chemicals latched in there will help break those off so that our natural hormones can get in there, do their when we get these endocrine disrupting chemicals that come in, these I view as like going with a natural sugar versus aspartame or any other the super high sweeteners that are 10,000 times the affinity of sugar compared to a single sugar molecule. So I compare those endocrine disrupting chemicals like that. So they have an affinity for these receptors, say 10,000 times. So once they get on, they're not moving, and they're going to trigger that hormone response in those cells constantly, versus our normal natural hormone that gets on there, does the job, then gets kicked off. Like our body can't kick off those endocrine disrupting chemicals. And so we have to give them nutrients and some herbs to help break those off, get those out of there. So then your natural hormone can come in and do their job. And I suspect this is a thought of my own, that we see all these cancers for prostate and then also breast and ovarian cancers that we're now down to look at, go like, okay, this is an estrogen receptor positive, this is a progesterone, this is testosterone receptor positive tumors. Yeah, those are all on there. What I think is going on is these endocrine disrupting chemicals are hitting these things and triggering these cancer responses in the body. And if we can get them off there and get them cleaned out, then we should see that start to dissipate, because our natural hormones shouldn't be causing these problems. And that's the research that has shown that, like, for women, especially through the Framingham study with nurses, where it was like for 20 years, they're saying, don't give them hormone. It's really bad for them. They were like, ooh, that's actually worse than not giving than giving them hormone. So they've come out and said those hormones don't cause those issues. And we're like, well, duh, because we've seen it firsthand in clinic. But I suspect that's a huge aspect that's going on, that if we can get these cells and these bodies clean and get these endocrine disrupting chemicals out of there, then our natural hormones can do the things, and we'll see those cancer rates decrease significantly.
From your lips to God's ears, maybe more clinicians do that kind of work. You mentioned herbs, though. Is this part of your Chinese medicine practice?
Yeah, Chinese medicine also within chiropractic is the herbal aspect of it, is using really good herbs that'll help boost testosterone levels naturally as best as possible. We won't see, any of the herbal ones that are out there, you're not going to see super physiological changes in testosterone levels, but you could see a couple 100-point change with those.
Nothing.
And even really good one in particular, maca, and there's different forms of maca itself. The maca OG, which is from Symphony Natural Health. I really like that one. The single case studies that are coming out with them are pretty darn good. We're seeing, levels of 200 to 300 plus increase in total testosterone just from using this maca OG itself. So that's got some pretty good research coming out with it and some pretty good responses for clients. So I really like that one in particular as an herb to help boost testosterone levels.
That's total testosterone. Does it have an effect on free testosterone?
Research that was done didn't show that portion that's been published, but some of the ones we're looking at to see how that changes with my clients itself, because I'm a nerdy clinician researcher of running a boatload of labs, so that way we know what's going on with somebody and we're hoping to see that change also, because boosting of total is great, but if that free doesn't come up, that's the tough part. But it seems to be working because the guys are getting responses with the maca OG changes, both not only just lab wise, but symptom wise too. They're noticing better erections, more energy, muscle mass gain, fat loss with doing it.
So dietary changes, herbs, nutritional interventions.
Mhm.
What about like physical training, peptides, prescription?
Yeah,
Let's fit into this.
peptides, if you can get them. There's some really good ones out there that work really well. Combinations for things. We always try to combine stuff. CJC, ipamorelin is a great combination. The BPC 157 is another great one there. There's a few other ones that we use. My mind's totally blanking on them right now. that we use in conjunction to help with that testosterone boost and exercise through there for that. So I like those. They're not a fit. I mean, you got to be doing. So here's the keys. We're always trying to find these shortcuts. We're trying to find these shortcuts, but you still got to do the work, and it's just going to make the work easier on your body. And especially for us guys that are hitting the middle years and beyond, this is going to help us recovery. That's the thing. We just don't recover as we used to. We can still lift just as heavy weights. We can add lean mass just as fast, but our recovery time is what becomes more of a problem for us as we age through there. So these peptides, the herbals, they're going to help recovery time. Another two peptides. I love peptides. The only two real other supplements I recommend for guys in the weight training world is creatine. There's just a boatload of research on that. And then HMB, the beta hydroxy beta methylbutyrate. HMB, and often creatine and HMB come combined as one in a product. You just mix it up, drink it down type thing, just powderize. And those two work. They work.
What does HMB do?
It's what it does. It's a alanine molecule. Yeah, alanine molecule. And what it does is, as you tear those muscle fibers during the workout, it speeds the healing process.
Okay. All right. I've seen a lot of research recently on creatine and brain health, not just physical capacity, but also
Well, you're shortening, the creatines give you that creatine phosphate, so that from ADP to ATP. So that adenosine diphosphate will take the phosphate off the creatine to then make adenosine triphosphate. So
biology, man.
I know we're going deep. Pulling out that Krebs cycle next. Sorry, guys. That's going to get, that having more creatine in the system is going to increase that CP. So that short burst of energy, weight training, quick sprint, it's going to help with that and allow recovery to go a lot faster, which in turn helps with brain function. Because if you're doing more working out, you're increasing butyrate production in the body and in the GI tract, and that's going to help brain function.
Are you saying we're a whole human system?
Yeah. Yeah, isn't that weird? Like
Yeah,
we're a whole balanced system that's supposed to work together and not be all these individual pieces that don't speak to each other. These little pods.
Yeah.
I would say little pods of the body that nobody knows what's actually going on because, we fix this one thing, but the patient still has this going on. I don't know. It's not my world.
Yeah, exactly. It's like, right. Yeah. You mentioned like weight training and sprinting like that. So do you have recommendations for your particular clients you work with in terms of cardio, weights, those kind of things?
Yeah. Where are they starting at? That's always a key. What's their starting point? And if they have a fairly good starting point, then really the HIIT training, the high intensity interval training, Tabata type workouts are great to hit. And strength training, short burst is really, really good too. I'm a fan of free weights. I love free weights. I love throwing iron around in the gym. And the joke where I'm at for the CrossFit I'm at, I've done CrossFit for about 10, 12 years now, 12 or 13 years now. I like it personally because it's for me, I don't have to think like how many sets, how many reps, did that for 40 years, kill me. I don't want to do that anymore.
Yeah.
But I just go in, here's the workout. And if I can't do something, I modify. That's the benefits of being a little smarter as we get older is we know our limits. Or we should know our limits, and we just modify, like our group, we just modify the workout. Like I can do this from, 3 different levels we have. I can do this from the high level. I can do this from mid, this low, and there's my workout. I don't have to do the RX all the time and kill myself as I can choose within there, get a great workout in, sore for days like normal and feel good afterwards. So I like the interval training. I like through there. I don't like long aerobic-y workouts themselves. Just because it lowers the testosterone levels immensely in guys. And we don't need to lower that. We don't need to lower that anymore. So that longer, faster endurance type ones versus a long, slow one is going to cause issues for guys. So it's always meeting where they at, what do they need support with, and how do we go from there. But I love the Tabata style and the high intensity interval training because that shows the research it works best.
That's what I've seen as well. What do you think of TRT?
I'm totally fine with testosterone replacement therapy, injection or pellet. I'm a fan of with guys. What we do often, I can't prescribe that myself, but my wife can. She's a naturopathic physician and can prescribe that. So often when we get guys or gals in and we're going that route, is I get them prepped, get them all. You can't. I'll circle back there, but we get them healthy, get them active, and then get them on the hormones there, because you can't just put hormones in a body, because if you're putting hormones in a crappy body, it isn't going to do a darn thing. They're going to feel good for a short period of time, and then it's going to be more hormone, and they're just getting worse and worse and worse over time.
Right.
So we take people, if you work with us, we take you through a whole program to clean up your body, get it healthy as possible as we're putting in, or before we put in the testosterone or pellets or whatever we're doing for you, estrogen, progesterone therapies. But I love TRT, works great. What we have found, and this mimics research, is twice a week injections works better than weekly injections. Smaller dose over 2 times a week, you get a better steady state versus this up and down that occurs. So that's what we usually start guys on before we do pellets with them, to find what their levels feel best at and labs feel best at. And then we can go to pellet therapy itself. So then they just have the pellets in, they have those in. And again, depending on activity levels, they get some pellets put in every 5-6 months.
Nice. Okay.
So you don't have to do twice daily injections, which for me, it was fine, but I got sick of, shooting my butt, because I'm on testosterone, guys, 100% honesty. I've done everything. Testes didn't want to work. So I've done everything, still do everything to keep my body as healthy as possible. And I'm on TRT, and I'm okay with that. So, but I like it because I don't have to do shots twice a week, and I feel good for a long period of time. When I start to feel it coming off, that's when I know to do labs and get my next set of pellets put in.
Nice. Okay, cool. Talk about the work you guys do. Where can people find out more about the work you guys do?
Gosh, all over the place. We're ubiquitous. No, you can go to our website, lakesideholistic.com. You can also find us on Instagram and Facebook, same thing, Lakeside Holistic. And then myself, you can go to drjerrybailey.com, and then you can find myself on Instagram and the Facebook, the Book of Face, with, Dr. Jerry Bailey there also.
Awesome. You do podcasts, you do public speaking, so you're also available if someone's like, man, I want this dude in front of my audience. You're available for that as well.
Yeah, I do many podcasts like yours here. I do master classes that people are putting on, different master class events and summits. I'm on 2 here coming up shortly.
Okay.
One getting released next month, and another one that's getting recorded for next month. The one is infertility that I'm speaking about for the men's perspective, and most of the other ones I speak on the men's health through there. Not just like the health stuff, but the mindset stuff too. And that's a big thing for guys, as you work with, I'll share this too, because I can. Mike's my personal mindset coach. So, you work with somebody you like, and it helps. And so we work with coaches. We have our coaches that do mindset with our staff too, with our clients also, because that's a big thing. I mean, you can have and know all the tools to do, but if your mindset isn't there, it isn't going to work. And you can have all the motivation or no motivation. It's the discipline of doing it every dang day that's going to get you going and doing it. And, there's tons of motivational speakers. And what do they tell you to do? Oh, here's a great quote. Here's a great quote. They work, they help get you going, but it's just making yourself do the stuff every single day. But you can find us through there. And I've done international speaking. I've spoken in Canada and online around the world, and lots of different places. Podcasts, summits, everything. So I like it. I like talking to people and enjoying people and having a good time, as you know.
As I do know. Well, I want to check out Dr. Jerry Bailey. Thanks, buddy. Appreciate you talking about the PHAT syndrome today.
Yeah. Thanks for having me.